Okay, I'm going to do a little bit of a controversial post. This is why I don't like saliva testing. In periodontal disease, it is a host based, site specific response to bacteria, and it's your body's immune response. We know the bacteria that causes periodontal disease. We know red complex. We know AA is a factor. We know all the different bacteria, fungus, viruses in our mouth that cause periodontal disease. So, what are we testing exactly? I think it can be a good patient education tool, showing the patient this is your baseline, these are the bacteria that you had in your mouth, this is after, look at, we reduced all of the periobacteria. So, yes, the load was reduced. However, here are the flaws. With salivary testing, what you're doing is spitting into a cup, similar to a DNA test. The issue is that's not the bacteria that's causing the deep pockets in the probing when we're going around and probing in the mouth. We want that bacteria that's deep at the base of the pocket. So, one way to get that bacteria in perio studies is to use a pipette and suck up the bacteria from the bottom of the pocket. The issue is that the pipette itself is too large to fit at the base of the pocket. So we're still not getting a true estimate. Another way is to get a paper point, kind of like a paper towel, and put it at the base of the pocket and pull the bacteria up. But the issue is think about like a paper towel. It immediately gets moist. So we're getting the top of the pocket bacteria before we get to the bottom. So yes, I think it could be a good educational tool, but really, if you think about it, what are we doing? I think it's a lot easier to explain to patients the cause of periodontal disease, the reason why it happens, and what we can do to help patients manage their periodontal disease. It's so host dependent, it's a host response, meaning it's that patient's ability to cope with that bacterial stress. They could have diabetes, they could have heart disease, they could have Alzheimer's, dementia, they could have an autoimmune disease, low vitamin D, osteoporosis, they could have an estrogen deficiency, their testosterone might be off, obstructive sleep apnea, family history, they could have a new partner, their bacteria change. So there's so many things that can be causing that periodontal disease. I don't think salivary testing is the answer. So I think that's a hot take, but comment down below if you find it useful in your office or you agree. Let me know.